Today we're going to be talking about the acronym HIPS. The other day when I did that quick, it was like the poker setting. I said I was going to introduce some acronyms and I didn't. I don't know what my brain was doing. But we're going to go over HIPS today. So HIPS stands for History, Inspection, Palpation, and Special Tests. So we went over this kind of in passing in class because it's something that comes up when you talk about injuries. It's a way to evaluate and assess the injury. So we're just going to get right into kind of the pattern of this approach. So kind of think an athletic trainer is on the side and they'll go in and deal with an athlete after they've been injured. Okay, so before we get into HIPS, there are a couple of other acronyms that you need to understand. So PPE, which my guess is everyone knows what that is now that we're dealing with coronavirus, but PPE stands for personal protective equipment, and it includes things like gloves and masks and gowns, sometimes shoe covers and things like that. So the idea is, if it's wet and it's not yours, you want to protect yourself, but you also want to protect the other patient. So there have been some idiots that have been going around like, oh, well, I'm going to be protected from corona. Whoopsh, whoopsh. And then they go into a store with these rubber gloves or these, latex gloves, and they're touching everything. And gloves are meant to, for example, in a medical setting, you'll deal with this patient, and then we're going to take the gloves off and put new gloves on and deal with another patient. So if a person is grabbing this product, they touched it and there was stuff on that, and then they're going to touch another object. So while they might be protecting themselves a little bit, they're not protecting anyone else with the protective gloves. But from a first aid perspective, because that's what we're talking about is first aid, we need to have body substance isolation. So that's what BSI stands for. So again, if it's wet and not yours, we have to find a way to protect ourselves and the patient as much as possible. Okay, so we start with the H, which is history, and depending on what it has happened, we can get a lot of information from the history. So some things like, where does it hurt? What happened? How did it happen? All of those kinds of questions. Did you hear a pop or a snap? Let's say it's an ACL. Okay, so maybe a plant twist, and then we had an ACL tear. Is it important to understand that this person maybe had ACL surgery before? Is this the first time they've ever injured it? Another example that could work really well here is if you have the patella come out of the patellar groove. So you basically have the patella dislocate and it's kind of flipped off to the side. If that's the first time that's happened, the soft tissue just stretched harder than it's ever stretched. And it's going to happen again and again and again to that person. So if you know it's the first time, it's going to take a little bit of extra effort to get that patella back into the place where it's tracking. And we're going to know that this person is going to have stretched soft tissue, and they're going to have it happen over and over again. So history is basically saying, well, what happened? Where does it hurt? How did it happen? But also you can get clues in determining structures that are injured by saying, have you injured this before? Is this something that has happened to you before? So we're just gathering information in the history segment. And if you're an athletic trainer, I don't know if you guys have ever seen Jessie on the sidelines, but she has her little fanny pack thing off to the side and she's watching and she runs out there. So a lot of times she knows, oh, they were hit. But sometimes, let's say it's a football game and we've got multiple people coming into a pile. You don't know exactly what happened. And so we can say like, okay, your foot's on sideways. How did that happen? And like that video I showed you before, maybe it was stuck between two guys' legs and that was a vise and it cranked it sideways or something like that. So history first. And then we get to inspection. So this is a visual inspection. So we're going to look at them. We're going to compare bilaterally. So if we say like, oh, because I've got my bone shirt on today. We say like this humerus looks pretty straight, but this one's all like curvy. And then we can go like, huh, when I look at it bilaterally, this one's straight and this one's curvy, and things like that should be pretty normal. But I've had a student in the past that had issues with the way her bones grew in her forearms. And so she did kind of have a curve to her forearm. So you want to compare bilaterally. Maybe this person has anatomy that's different from yours. So compare to see, like, does this arm look like this arm? And with the history aspect, you could say, like, has this ever happened before? Is this deformity a normal thing? So another thing that you can do is, let's say it's a shoulder injury.
Ouch.
If they're going like this, remember they're kind of holding themselves. You can't really see me, but I'm holding my elbow. So if this was the injury up here and I'm kind of doing this, that's called guarding. So if you notice that they're guarding or they're limping or their face looks like this, that's a face that's like, that doesn't mean happiness. That means he's not comfy. So also look for things like bleeding, deformities. So if the clavicle's broken, you would see probably one part of it's up and one part of it's down. You could see swelling in the area. It could be discolored. Just look for signs of injury. This is just, you're using your eyeballs and your occipital lobe, right? And you're actually going, what's happening? What's happened to this person? It doesn't take that long. So I'm going through these steps kind of in a slow fashion. But when you're on the field, it's not like you're going, okay, history, and you've got a long worksheet. Tell me about this. Because you just want to get as much information as you can while you're doing it. It's kind of, first aid is really something where you're multitasking, and you kind of have to be. So if it's something that's real serious, like you can tell maybe there was a spearing hit and the dude just falls unconscious. If that happens, we don't want to mess around with that. If he's out and he's still out when you get out to the field, then we need to get some medical responders there. So we need to call 911 and say, hey, we have a pretty serious brain injury here. Next is palpation. So palpation is to touch and feel. So this is where we actually will go ahead and touch the patient. So let's say that we suspect something of a head injury. We've gone through the history. What happened? So another story, I gave you lots of stories, was the girl that was walking across the volleyball court and got hit by the overhead serve and got a concussion. So we could have gone through and said, do you have a history of concussions? And she was like, me, but her dad knew. Her dad said this was her 6th concussion. We checked her pupils. We were asking her questions. So those are all kind of history. The history part is going to be all the question asking. And then the inspection, we're kind of looking at her, looking for changes. And when we're looking at her, we can see that her pupils are constricted, and we can shine a light in it, and it's constricted. And sometimes you get, if it's a bad enough injury, you can get one that's dilated and one that's constricted. So we're looking for pupils that are pearl, pupils equal and reactive to light. So we've asked questions. We've visually inspected it. Now we're going to go ahead and touch it. So if it was a head injury, we're going to basically palpate the head, and we're going to palpate the neck. And of course, asking permission, because if you touch a person without their permission, that's called battery. So we're going to say, is it okay if I touch you? And you can say like, okay, but we're going to touch the head, the neck, maybe the shoulders, kind of and there is a sequence that you should go through. If you know you're on the field, and you see that the person went down with a sprained ankle, it's really not necessary to be like, let me touch your head and your back and everything. If we know that it's just a sprained ankle, we can go ahead and treat. But if there's been some kind of a mass collision, then maybe we don't know what all the injuries are. So now we start to palpate different regions of the body and see if we get tenderness, see if we get some flinching, see if we get some signs that way. So we want to start away from the injury site when we palpate. So let's say clavicle, it's here, and they're guarding already. So we kind of know, like, they fell on their shoulder, they fooshed, and you can kind of see where it's sticking out. There's no need to go like here. I'm going to press here on your clavicle where it's broken, you kind of can palpate away from it and say like, is it tender here? Is it tender here? You don't want to like touch the injury. So you can examine bilaterally with your eyes, but then if it's something that's pretty obvious, there's no need to be like squish, poke. So finally, we have special tests. So at this point, we have gone, okay, there's an injury here, and this is what I suspect it is. And so now we're going to see if I'm right. So we'll look at this picture right here. And I've shown you some examples in class. So they're running through different, so this is an anterior drawer test. So they're kind of pulling forward to see if there's give in the ankle on this one. This one is the empty can test, where you kind of hold your arms out and you're pushing against it. Here they're checking for their circulation. So if we had an injury somewhere on the arm, a lot of times we're going to pinch the finger, and we want to see that within 2 seconds the color goes from like light to back to the normal skin color. So you just kind of pinch it, and that's going to give us the capillary refill. That's what that's called. We can do special tests like for vitals and check blood pressure, and maybe if it's a function test, if this kid wants to go back in and they're like fell over, I don't know, maybe it was a micro tear, sprained ankle or something like that, we can do some functional tests to see like, oh, are you okay? Not necessarily for that game. But other tests, let's say it's a head injury, we're going to ask them a lot of questions. What is this game? What's today? And sometimes since, well, we're in quarantine, so I'm like, ask me what today is. I don't know. It's 420. I know that. So let's see. So you ask them what the day is. What part of the game were they in? I don't know. Just ask them all kinds of questions, and then we can perform special tests. Okay, so the special test can range from a bunch of different things. So range of motion, that's kind of showing you, here's an example of like, let me see what you can do with your shoulder. Let's go ahead and have you go through an active, like a range of motion, just to see if it's working right. Okay, with range of motion tests, so these are the different types of special tests. You can have differences in how you're testing it. So an active range of motion test is going to be where the person is actively moving you through a range of motion, versus a passive one is where the movement is done by like this guy. No one's helping him. He's doing it. And then resistive, an athlete is asked to perform a movement while an examiner provides resistance. That's what he's doing right here. So he's providing resistance. He's pushing down while this guy's pushing up. So lots of different range of motion tests. We've done some in class. When we talked about the shoulder, we actually kind of watched them. I had you run through it. If you want to see more, maybe I'll throw in a video of special tests that we could do. So this is where we need to see, like, we could be using a goniometer and being like, oh, well, your range of motion should be here because we're comparing bilaterally. This one can do it and this one can't. But history could also come into play, because we could say, have you had issues, let's say, with the fingers before? And maybe he said, well, one time I was real mad, flipped a guy off and a bird hit my finger. Deserved it. And it broke, so my range of motion's never been. That was such a bad story, but whatever. So you can find things with these range of motion tests, like if it's weak and painless, possible 3rd-degree strain. If it's weak and painful, maybe there's fracture. If it's strong and painful, maybe we tore some soft tissue. If it's strong and pain-free, no muscle injury. So it's kind of the gamut of special tests. Here's another one kind of running through range of motion, looking at the ankle. They're neutral here. Range of motion goes through. They should be able to plantar flex, and they should be able to dorsiflex. And if they're compromised tissues, that will show up. Okay, some other things we can do. A stress test. So we're trying to, this is an anterior drawer test. There are multiple anterior drawer tests. This is also an anterior drawer test for the ankle. But this is a stress test. They're basically seeing, he's like, okay, is the tibia actually moving forward? Because there are ligaments in place that should prevent that. So remember that the ACL is going to prevent the tibia from moving forward, and the PCL is going to keep the tibia from moving backward. And he's seeing like, well, what do we have here? Do we have an ACL that's intact? So we're looking for ligament stability, muscle imbalances. So if we're providing a stress, then we can see what structures are compromised. For a neurological exam, some of the things that we can do is we can palpate, so we can run our fingers over the area of the skin on the affected or the unaffected side. Some other things that we can do for sensory function, this is a reflex hammer, so we can test reflexes on the different sides to see, are we getting the same kind of nervous system reaction? That's another kind of special test that we can do. For circulatory tests, we want to check the pulse distal to the injury, because if it's not coming through, or if we're not getting good capillary refill, that could suggest that the injury also compromised some blood vessels. And then functional tests. So this is where we start to get into kind of like physical therapy stuff. But functional tests can determine like if you can return to a sport. So if you go to a physical therapy clinic, you might have stuff like this, where he's like, okay, stand on one foot, throw a ball against a wall. When he can do that, then they might go ahead and say, all right, let's see if you can do the same thing, only now we're going to provide an unstable surface and see if you can still do it. And they're kind of testing coordination with some of the skills that would occur in your sport. Go ahead and do a walk. We can have them do jog. We can do runs. We can run in lines, squats. See what their 1RM squat is, see if that's changed from before the injury, see if we can get them back to full functioning. If maybe they tore their rotator cuff, let's see how they're throwing now that it's fixed. Okay, and we can stand on one leg, test a balance. If we've got ankle issues, if we got knee issues, we're checking their proprioception. Okay, from all of that hips evaluation, then you have to make a decision. So you shake the 8-ball and you're like, okay, does this person have an injury? And if the 8-ball says, as I see it, yes. Okay, you don't shake an 8-ball, but after completing the hips evaluation, you'll decide what kind of care they need. Do they just need ice and maybe like the ACE bandage that you guys just did because they sprained their ankle and it doesn't seem too terrible? Does it seem like their foot's on sideways and maybe we need to call 911? Just kind of play it by ear, whatever the injury is. So one story really quick from my, I was playing on a rec softball league with a bunch of ladies. It was pretty fun actually, but the other team was up to bat. This lady slid into second base, and as she went to stand up, her foot stayed on the ground and her leg came up. So it was clear that she had like, basically it was like kind of like Gordon Hayward's injury when he went to Boston. So her foot was just not working properly. We called 911 in that case because we're like, it's broken. It's so broken that like it seems like it's not even connected to her body. That's a good time to call 911. If it's the first time a person's had a seizure, that's a good time to call 911. So yeah, you make a decision from that hips analysis. And that is all for today. So I will make another video for Friday.